Okay.
And we are live. Hi, guys. Welcome to our sixth session, live session. And today we are going to discuss about cancer prevention, as you can see from the title. So allow me to briefly introduce myself, then I let my guest introduce herself. So my name is Lilian Mumina. I am a registered clinical nutritionist with passion when it comes to matters public health, prevention, of course, and definitely metabolic health, where cancer lies. And my guest for the day today, she's Eunice. Eunice, kindly introduce yourself, then I will introduce the topic, then we can start on the discussion. And as she does that, if you have any concern, if you have any questions when it comes to matters cancer prevention, cancer management, and nutrition, feel free to leave it in the chat box or in the comment section. As we go, we'll definitely try and address as much as we can. So Eunice, karibu sana, kindly introduce yourself and let us know why you're here.
Hi, guys. Welcome. My name is Eunice, as you have heard. I'm a registered nutritionist. I've also specialized in pediatric. So, whatever we are talking about today, Lilian, something is wrong with our voice.
No, I can hear you. I can hear you loud and clear.
Something is wrong with our voice.
I can actually hear you. Na nimeconfirm pia I can hear you from the phone.
All right. So,
Yeah.
okay. So, I can hear an echo from my side. But basically, what we're talking about
Let me
today.
mute my mic. Let me mute my mic
All
because
right.
the echo is coming because I am not muted. Let me mute my mic so that you can speak with.
All right. All right. So, I can authoritatively say that myself and Lilian can discuss this topic because we can see the rise in cancer development in Kenya. Metabolic and lifestyle factors are an issue. So early nutrition influences really are important when you talk about lifelong health. So karibu sana. I am a private practitioner. I post on LinkedIn. I have a very funny newsletter talking about the struggles of motherhood, career, and juggling the two. So yeah, thank you so much. I'm honored to join you today, Lilian. It's really nice. So I'm hoping that we're going to educate the masses.
Definitely. And maybe just to clarify, your newsletter is not funny, it's very relevant. In fact, I think we're going to have a conversation on that soon, on adjusting to motherhood and all that, because when you check on motherhood, people just they're either showing how they are doing vlogs, but no one really talks about the nitty-gritties that you're talking about. The people who are talking about that is very few. And I know we both understand the deeps that comes with motherhood. So I think that will be a very interesting topic. So you guys make sure that you stay around. Eunice, you will come, we discuss that. I think the main reason that you're discussing this cancer is because this week was and last month was all about cancer, but I'm definitely going to talk about women and motherhood because that is the center, or that is what I purposed this channel to be all about: women, motherhood, and nutrition, and all that. And the aspect that you write about is very, very important. So it's not funny. You guys need to follow her. She's called Eunice Simpiri on LinkedIn, and she has amazing and very relatable content. So if you're a struggling mom, if you're wondering about your child's development stages and all that, she really clearly outlines that in the letters, and you'll get a thing or two. Best believe you'll get a thing or two. Even I, the professional, actually get a thing or two. So karibu sana Eunice. I think what we'll be doing when I'm speaking, you'll be muting your mic, and when you're speaking, I mute my mic so that the echo is not there. That's okay.
Yeah, sure. I can hear you, Lilian.
Okay. Sawa. So why cancer prevention? Allow me to introduce the topic. As we are aware, the numbers are rising steadily in Kenya and other low and middle income countries. Yes? Eunice? Okay, great. So allow me to introduce the topic. Sorry about that. As we are aware, the cancer numbers, all types of cancers, when you're thinking about cervical cancer, liver cancer, lung cancers, stomach cancers, reproductive cancers, name them. They are on the rise in the country and other low middle income countries as well. And the numbers are steady. And with the projections that we are currently expecting, we're actually expecting the numbers to get worse, which is quite unfortunate because our public health system cannot even accommodate what we are struggling with currently. So with a steady projection of an increased rise, it will be kind of a disaster. But we are hoping that we are going to have more interventions or more people actually coming in to talk about the preventive aspect, the protective aspect, and the promotive aspect of preventing such conditions, cancers and other NCDs. So this topic is very, very important. And as we are aware, nutrition plays, that is basically your food and how it interacts with your body's normal routines and activities and such, actually has a significant role or plays a significant role in developing or prevention of disease. And cancer is not spared. So when you think about nutrition and cancer, most people actually, the unfortunate bit is that in our country, when you think about nutrition and cancer, it's only thought about after the prognosis, like the disease has gone, it has advanced. Now that is when the physicians or the oncologists will actually refer the patient to the nutritionist when the patients are actually catabolizing. But you see, for nutrition to actually come through and to be effective, for nutrition to be actually come through and be effective, okay, my sound. Eunice, what is happening to my sound? I wanted to do a mic because it kind of concentrates the sound somewhere. But as I was saying, for prevention to be really, really a thing, then we need to make sure that we are working towards now steering conversations that talk about prevention, and they talk about early screening, they talk about diagnosis and such and such. So today's conversation will center on that, and we are hoping that we are going to ensure that we continue with such so that excuse me, that we can continue in educating our masses and making sure that things run smoothly. Now, this is a mic. I would rather use the USB cable. Just small hiccups. Allow me to connect my mic so I can center my noise. Though there is no much background distraction today, I'll use one. But my voice is kind of, can use both. Why not? Why not? Eunice, kindly confirm how my audio is. I will not want to talk. Why am I sneezing though? Okay. That is it. So as we wait for Eunice to come back, so let me just give us a brief outline on what the topic or what you're going to discuss today. So as I've said, we're going to talk about how nutrition influences inflammation, immunity, and blood sugar control. And you're going to also talk briefly about the role of the gut, or basically the gut health, in cancer prevention and maybe we can touch on screening and management and such. And of course, we are going to highlight some foods and dietary patterns that support metabolic health, lifestyle habits that increase or lower the cancer risk, and as well practical steps for adults, families, and children on why prevention must complement treatment. And when we talk about why prevention must complement treatment, I want us to think about the larger picture. I want us to think about that person who is at home currently and they're not having access to any form of health information or health awareness, and how we can protect them. Because as healthcare professionals, as healthcare promoters, as public health enthusiasts, we are supposed to protect even those that do not know that they need to protect. That is where we have things like policies. That is why we have things like strategic plans. That is why we have things like acts and laws to ensure that even that person who is yet to be aware about their need to protect and prevent themselves, or actually take care of their health, they're actually taking care of their health as we work towards awareness and education. I don't know if Eunice is back. Good.
Yes, I'm back. I don't know what
Good.
was happening on my side, but now I can hear you. I can see you.
Oh, great, great.
Yes, I'm
So,
so
Eunice,
sorry. Yeah, I'm so sorry.
no, it's okay. Actually, you've made me actually put on the mic, and I'm thinking that when you know the thing with this app, the streaming app that we're using,
Mm-hmm.
when I'm talking and you're talking, we need to mute the mic. Like when I'm talking, you mute your mic, and when you're talking, you mute your mic so that it doesn't echo. And if you actually to
Mm-hmm.
stream anything, you
Yes.
reduce the volume kabisa, you mute kabisa.
Okay,
If
okay,
you
okay.
you're using the phone, you just mute kabisa.
All right, all right.
Yeah.
I think now we are on the same page.
Oh, great. So I've actually introduced the top,
Yes.
and now maybe we can just you can highlight if you don't
Yes.
mind, like, because we know that cancer is, when you think about cancers, most people actually come in with the aspect when you're talking to advocacy and policymakers, they don't want to integrate nutrition into the prevention aspect. They will start telling you
Yeah.
that cancer is genetic, cancer is environmental, cancer, there is no aspect, but we all understand that nutrition actually influences genes and the role, environment, and all that, toxin exposures. So I think maybe we can highlight how cancer is a metabolic condition on top of being a genetic condition. And we know for a fact that more than 80 to 90% of all genetic cases can actually be prevented with the right intervention and the right preventive strategies. So how is it, like, maybe you can help us highlight how cancer comes in as a metabolic condition.
So I think first of all, because you recently did a very nice paper on metabolic health, you are the best person to explain this context because I know you did the research. You did. I don't know whether you've told people that you really did a good job in publishing. Please explain to us how metabolic health is, what it is first, and then we can maybe look at the relationship between cancer and metabolic health, if that's okay with you, Lilian.
Great, definitely. Yeah, and thank you for reminding me. Let me just tell you guys, Kidogo, we were recently
Yes.
published. My co-authors and I, we did a very good paper on gut health and how it influences metabolic syndromes like obesity. So let me just highlight how cancer becomes a genetic and a metabolic conditions. So Eunice, maybe you can mute your mic because I can still get you in my background to make sure that we are not people can actually hear me. So when you think about your body is a powerhouse. Your body has the basics, that is basically the homeostasis balance or the homeostasis system that actually works to ensure that things are in balance, to ensure that whatever, if you have excess toxins, if you have excess food, if you have excess anything, it is removed so that things can be streamlined. Now, if you have the gene exposure of cancer, of course, it is easier for you to develop cancer if you are exposed metabolically to things that actually alter your normal routine. Your normal routine, I'm talking about gut health, but we're going to get into gut health shortly. But before you get to gut health, let's just talk about the normal physiology of the body and how it works. So if you're exposed to too much toxins, if you're exposed to highly refined foods, if you are exposed to high chronic stresses. By the way, I was doing a research the other day, and stress correlates, or stress is one of the leading causes of one of the causal factors, because there's nothing that has actually been directly pinpointed to cause cancer, but stress has been correlated to high number cases of cancers in both genders. Like in women, it correlates to high cases of reproductive cancers, and the same case to men and such. So of course, if you expose your body to such conditions, then the genes and the environment, the inflammation, the oxidative stress, all these are actually going to intertwine, and they're going to start now altering the cell's DNA or the cell's makeup. And now you will start having mutations. But again, when you think about your body, remember we said that it has a homeostasis system that tries to actually now try and balance things. When this system now notices that it has some what is it called, it has some cancerous, or it has some cells that are metastasizing, then now your system starts to fight back. Now that is where now things like anti-inflammatory diets, stress management, and all that are preventive before you even get there, now in the precancerous stage, before now you start getting into the cancer cells. Now this is where now your body is now trying to fight off, your body is now trying to cool off the inflammation. And when you start doing the right things that you're going to talk about shortly, then your system actually adjusts positively. But if you don't, then it now moves from the precancerous to now the cancer cells, and that is where now cancer becomes a metabolic condition. Because as I stated, this is someone who's not genetically exposed, but they have been exposed to other conditions that have been associated with the development of cancers, like high chronic stress, like poor environmental or poor exposure to toxins, poor dietary habits, too much smoking, too much drinking, or even, it's very easy nowadays. Kitambo, it was like we used to say that cancer is a disease of the old, cancer is a disease that comes in from alcohol and smokers, cancer is something that comes in from specific groups of people. But now we are seeing even cancers in children who are just very tiny, and it's quite unfortunate. So yes, cancer is both a genetic and a metabolic condition, and the best rules or the best avenues for us to actually prevent and reduce the number of cases that we have in our country is basically to now focus on metabolic as we focus on the other aspect. I know the Ministry of Health has come up with policies like the tobacco smoking policy, the one that are trying to now market alcohol reduction, mental health for clarity and reduction of stress. They have also included, and I quote, included nutrition as part of the strategies of preventing and reducing the number of cases. But we know the integration has been a bit poor, so we need to focus on that for that purpose, because there's a lot of avenues for change, there's a lot of avenues for prevention when we focus on our metabolism. Because again, as I've said, when the body is trying to, now the inflammation, the oxidation is trying to attack your system, your body will try to fight it off. And if you provide the avenues for fighting, then your body will be able to fight before it develops to cancer. Even if you get the cancers, of course, if you're still undergoing the treatment and you marry that treatment, or you integrate nutrition or proper nutrition care for that treatment, then you're going to have better outcomes. There's a lot of data, and I think I will share that in the comments on the data that actually show all that. So yeah, that is true. Cancer is both a metabolic and a genetic condition. So do not think that because no one in my family is struggling with cancer or has ever suffered from cancer, I will not get it. If your habits are bad, and sometimes just bad luck, because as I have told you, there is nothing that has been directly linked to causing cancers. It's just factors or like causal things that have actually been associated with the development of the various cancers, apart from maybe HPV and cervical cancer, where we have vaccination, and even that we have actually established that this is what is causing our women to get cervical cancers. the uptake of vaccination, screening, and treatment is still low in Kenya and many low and middle income countries. So maybe Eunice, you can, because you focus on children, you can highlight the dangers that we have when we ignore things like nutrition for our children and our upcoming generation.
Thank you so much, Lilian. You've done a really wonderful job explaining the connection between metabolic health and cancer. Because I think we've come to a place where we just thought that cancer is for older people, like people who are obese. But we've come now to the realization that even people who are slender, who like look like they're living a good life, like they're eating well, but we have other factors. So in this case, in our children, for example, right now, our lifestyle has really been um, centered on urbanization. And we know that in urban areas, we're exposed to toxins. The food that we eat, we do not even know the source. We have a lot of chemicals that are used in our foods, unregulated fertilizers. We know that the other day we had an expose on one of the television stations that really we just have a rampant use of fertilizers and chemicals that are not regulated. They've been banned in other countries, but in our country, the use is just random. So we're having that. And, most mothers are working in informal settlements. Some of them are working in flower farms and even in farms that every day they come in contact with agrochemicals. Imagine our whole food system, like the whole ecosystem of the food is coming from these dangerous things. So remember, that we're not only dealing with cancers that are genetic, but they're also environmental. So in this case, when you talk about lifestyle, let's not just focus on how we live, like the sedentary lifestyle, but let's talk about how we eat, the access to food, the food systems that we have, in place. Are they exposing us to cancer, or are they actually, are we eating to just be full, or are we eating because we want to be healthy? So I remember a past conversation that we had with you. We were talking about nutrition security versus food security. We might actually have food, but how safe is it? How is it nourishing us? That, and that is a big issue that we need to talk about. So in this case, let's talk about cancer in children. We know that we have some statistics. Globally, we have about 400,000 children that are diagnosed with cancer each year. Not right now, but each year. As we speak right now, Kenya is a growing concern, especially in public health, because we have 48,000 new cases of cancer in children, and it's the third leading cause of death in children after infectious diseases and cardiovascular. So we remember that cardiovascular can also be a cancer. Okay, so we can have cardiovascular cancer. So the reason why we need to talk about this is because we need to see children are involved in the whole life cycle. If we have healthy mothers, we're going to have healthy children. But if we have mothers who are constantly exposed to factors that are going to give them cancer, now imagine what is going to happen to the children. So as much as we have lifestyle issues such as the sedentary lifestyle that is causing cancer, we also have exposure to the UPFs, these foods convenience foods that are causing cancer. We have an unregulated market that sells cheap, junk food to our children that we did not have that, in the previous years. So that is a growing concern that we have right now. Our children are in a high risk of developing even childhood cancer, such as we have heart issues. So I think that is basically why we need to be talking about this. So yeah, we have about new cases of cancer in children every year, about 48,000 of them. So thank you.
And I agree with you, Kabisa. I agree with you, because the concern about these conditions getting to our children is a serious one. And unfortunately, as I've told you, I've interacted with mothers. Mtu anakuambia sasa hizo ni gani, mtoto wangu hawezi kuwa amepata cancer, and already the child has already been diagnosed, and they'll still be in denial, thinking that haiwezekani. I know it's hard, but saa zingine tunakubali. I don't know why I'm sneezing, the way it's hot. But forgive me for that. So I think, yes, we need to highlight on the preventive aspects of pediatric cancers, because we cannot be comfortable with the numbers, And this condition, as we say, the food safety. Me, my biggest worry, my biggest concern It's not even the strategies that I can actually control. Like I can say I will make sure my diet is on point. I'll take care of my gut. I will have my exercise. I'll take water. But again, what about the quality of food that I'm eating? I think we need to have a lot of noise when it comes to our food safety and the toxins exposure that they are actually exposing us. Because you cannot say that you'll be safe just because you're at home or you're in your rural area where they are producing that food. No, you won't be. Uh, Sorry about that. So you won't say that, and it's quite unfortunate because you can do everything right. You can make sure that you're doing everything right. You can even try and make sure that you're not getting exposed to the microbial infections that still cause diseases. You can take care of your blood sugars. You can do all that, but still develop cancers because of other things that you cannot control, like pollution, other things that you cannot control, like the quality and the safety of the food that is available for you to choose from, the quality and the air quality. Like say ukitoka tu hapo uende tu Tao in the CBD unazunguka. That's why I don't like the CBD so much, because I end up crying so much. My eyes come back red. I look like I've been crying the whole night. So maybe Eunice, we can touch on some of the things before we get now to the specifics that we can actually do. Some of the things that we should actually get support from the government and the international community to actually try and help us reduce the occurrences of these conditions in general population.
Thank you so much for highlighting that. So I think the government just needs to protect its people. The Constitution states clearly that we have a right to be protected. Our health is in the hands of, we have a collective responsibility. But then the government is the one that needs to ensure that the products that get into our country, what we eat, in terms of farm inputs, fertilizers, the pesticides that we use, are they safe? What about the pollution levels? What kind of emissions are we getting every day? What about the waters? The rainwater that we use, we might not be in control of that. But if the pollution that we are emitting is going to affect the waters, then we know that our rivers downstream, what kind of water are we using? That is actually in the hands of the government. So I think those are some of the things that we need to check, especially in the advocacy part. I think I've seen a lot of advocacy going on in food safety, food security. Yes, it's there, but something that we can control is within our hands. Like maybe you can do you can do your own farming, especially at home, like organic farming. That is sustainable. But what about in school? What about your children that you're sending to school? What about your folks who might not have access to you and who might not have access to farmland? What about people who do not have? So those are some of those that we need to check, because focus so much curative services. What about if we concentrated know that it's economic, so people who are entrepreneurs, we know that does not make sense to them. But if we just did, the benevolent thing to do is just to put the needs of the Mwananchi first. Check our food systems, check the safety of our, the food that we eat, basically, because at the end of the day, we know that it's not just the food, but what about the products that we use, the soaps that we bathe with, basically, you go to the internet and you check about all the chemicals that are just unregulated that are going into our bodies. This river road, because we have a lot of products that are just being sold rampantly. And we know clearly that research has been done that these products are harmful to our bodies. Why do we have regulatory bodies that do not control the things that they're supposed to regulate? Why do we still have toxic products in our market? Why do we still have toxic food? Why do we still have expired food in our shelves? Why do we still have, sugar to be recalled? Why do we have the government recalling oils? Why did they get there in the first place? So if we can just be protected by the Consumer Federation of Kenya, the Kenya Bureau of Standards, so many bodies that we have, and I don't think that they're doing their job, because all these things will not be happening if the government just did its job. So I think that it sounds like a rant, but that is the reality.
It's a sad reality actually, because the bodies exist. Watu wanakula mshahara every month. They are getting per diems to go and develop policies that they never implement and work they never do. So we need to do a lot of noise on that, because in as much as even you who's doing the organic farming, you might still be watering those plants with contaminated water. You see, water that has been contaminated with a lot of toxins from all this lack of regulation. So we need to stay woke and demand. You know, the constitution is the highest form of law in the country, and it clearly outlines our right to safety and quality health. And that includes safe food, nutrition. So we need to stay woke. So maybe because you've talked about preventive now, and someone might, the word preventive, I think it's self-explanatory, because we have talked about how we ignore preventive, we ignore protective care, and we focus on the curative. We know the curative still has a lot of gaps, especially when it comes to matters nutrition, where we're having poor integration of nutrition, you're having poor use of the clinical oncologist and such. So maybe, I don't know, maybe we can maybe we can relate why the NCDs like cancers, or the lifestyle conditions like cancers, are rising despite us being aware of the protective and the promotive aspects of care when it comes to cancer. But I think you have talked about ignorance and having policies that do not talk about that, so that we will skip. And then now the concept of modifiable risk factors. This is where we are going to talk about today, because that is what we can actually control. You know, we are the others that we were talking about, the laws, the implementation of the policies, the regulators doing whatever they are supposed to do, the food markets being regulated, the hazard control analysis, critical points, and all that. Those are some of the things that you cannot control at a personal level, but you can influence. You don't have to, it's a social media era. You can talk about it until someone sees the need to actually act. So, yes, you can influence. You might not be able to control some of the non modifiable factors, but there are modifiable factors that you can actually control. Now, assuming that things stay constant, chakula ni safi, maji ni safi, hewa ni safi. Those are some of the things now that you're going to talk about. And I think this is where we introduce the concept of metabolic health that I introduced and I told you about it. So when you think about metabolic health, you're going to think about controlling your blood sugars. You're going to think about reducing inflammation. You're going to think about hormonal balance. You're going to think about gut health and immune function. Maybe Eunice, you can start us off with one of either, so that we now, or I can start us off with gut health, and because that is basically why everything starts in your stomach. You know, before you control your blood sugar, you have to eat that food. Before you control your hormones, or before a food actually affects your hormones, then you have to eat it. And also, before you have inflammatory or oxidative stress from certain consumption of foods or consumption of certain foods, then you have to have eaten it. So I'll talk about gut health, and then Eunice can take us through another one. So gut health, when you think about it, it's basically how your body utilizes nutrients, that food that you have actually taken, by maximizing or utilizing the enzymes in the stomach, the acids, and definitely the microbiome or the microbiota. That is basically another living environment, or another another creatures that live in your stomach. That is what we call microbiome, or bacteria. And as you are aware, I'm sure you have come across good bacteria, you have come across bad bacteria, you have come across dysbiosis or balance. And it is very important that we prioritize gut health and digestion, because first and foremost, the balance in your tummy actually influences how your body is going to utilize the food that you have given it, whether it's going to use it for nourishing, for utilization in your metabolic health, or it will not be able to metabolize it well. It all starts in your gut, because if you've taken your food and let's say you're having a leaky gut, you're having H. pylori, you're having other stomach issues that actually now have a negative balance when it comes to your gut microbiota, then that compromises digestion, you're going to experience indigestion, you might experience high stomach acidity, you might experience pain, and all these actually alter food intake, digestion, assimilation, and utilization. So as they say, or as research says, 70% of your immune system, 70 plus, not just 70%, is actually linked to your gut, and healthy microbiome supports detoxification, that is basically removal of excess either foods, excess waste, and certain things. I don't know why I'm sneezing. And it also actually helps in vitamin production and inflammation control. Very, very important. And as we are aware, dysbiosis, that is basically imbalances in your gut, has actually been linked to insulin, obesity, insulin resistance, and of course, some cancers, basically stomach cancers, and even the colon and all that. So we need to ensure that we are prioritizing gut health. And how do we do that? We come in with consumption of fiber, because we know that beneficial fiber, actually the good fibers, either soluble and insoluble, you need them both. They actually feed the good bacteria, and of course you must make sure that you introduce the good bacteria in your stomach. Let me just give you a small concept of the gut bacteria and how it comes to be. When you are pregnant, like when a mom is pregnant, they are supposed to actually make sure that the baby is highly protected in the placenta, in the womb. So there is very minimal interactions with bacteria for that child. And the mother, of course, she's actually encouraged to ensure that she's eating or consuming foods that are actually, oh my goodness. I think ningevaa sweater.
Pole sana.
It is well, but the mom is actually encouraged to make sure that she's eating foods that actually promote and actually support gut functionality and digestion, so that the baby can be getting quality nutrition even in the womb. Now, when the baby is born, that is where the exposures from gut microbes comes in, because now in the vagina or in the birth canal, the baby is actually exposed to, we know that place has a lot of bacteria. The baby is first exposed to bacteria there. And even if you give birth through C-section, the baby is still going to get to the environmental bacteria that actually exist. And one thing that we must continue promoting, if actually we are supposed to prevent the occurrences of cancers, is breastfeeding. Because when the baby is breastfed, now from the environmental exposures, from the exposure from the birth canal, interaction with family members and such, the baby gets exposed to so many numerous bacteria and such. And you remember now they are feeding or they are building their gut flora composition. Now we need to feed this gut flora, and from now childbirth, we feed them through breastfeeding. The breast milk has oligosaccharides that actually ferments in the baby's colon and actually now feeds the bacteria that has actually been introduced. Yeah. So the breast milk introduces nourishment and still food for the bacteria to grow. Now you start repopulating on the gut microbes. When the baby, now the continuous breastfeeding, that's why we actually encourage continuous breastfeeding for 6 months as a preventive mechanism of NCDs. And now when you get to complementary feeds, you're supposed to ensure that now you maintain diversity when you're introducing the foods. Give the babies, avoid ultra-processed, as Eunice has said, give the babies quality nutrition, give the babies good food, give the babies diverse food so that they can actually have diversity when it comes to the enzymatic action, acid needs and release, so that the microbes that they were actually introduced do not become dormant and they start dying. Because if something is not used for so long, they're going to die and stop working. And this actually now reduces the diversity of the microbes, and this causes now exposure to conditions like inflammation, poor nutrition, poor digestion, poor utilization of nutrients and all that. So of course, that is why we encourage diversity when it comes to complementary feeds. And then that concept is still very much highlighted in adulthood. Eunice, I don't know, you're the pediatric nutritionist. I just wanted you to confirm that.
Yes, as you're speaking about breastfeeding and gut health, I was just remembering the study that was done by Dr. Katie. You remember that Dr. Catherine Hinde, that she did about how breast milk changes from situation, from gender, factors, if there is stress, the breast milk changes. That is a very interesting thing that has been overlooked, because the role of breastfeeding in gut health is very important, because it forms a foundation of lifelong gut health. And we know that gut health and metabolism are, twins. So basically, you've just spoken about something that is very important, setting up a foundation for the child to have a gut health forever. So in terms of sicknesses, in terms of cancer prevention, it also determines a lot with the maternal nutrition. So when you have a mother that is healthy, when the diet is healthy, we're going to give birth to a healthy child. So in terms of that, I don't think we have a lot of control. And I was smiling throughout the session when you were talking about when we have a perfect situation, like the perfect conditions for, we do not have pollution, we have safe water, we have organic foods. So when you talk about the modifiable lifestyles, modifiable factors, the things that we can control, things that are within our reach, such as having healthy food. Now, the thing that we need to talk about is habits, behaviors, the things that we set the foundation for this child. So remember, if the child comes to a family that values good health, that values, a lifestyle that is active, walking outside, not when you're born into a family that values TV and screens and sitting down, watching TV, popcorn, just sedentary. When you're born to such a family, I don't think you have the chance of, surviving childhood obesity. But you can control that later on. So these are some of the things that are very important to us right now, is understanding that even the lifestyle that you choose as a parent is going to affect lifelong habits of this child. So the family is a determining factor of the child. Yeah, when you start complementary feeding, you're most likely going to give this child what you eat every day. You're not going to go to the market and start buying things that you do not usually eat. Yes, you might be advised by a nutritionist that you need to go and buy, foods that are traditional, healthy, fiber, heavy foods. But at the end of it, you'll still have your, chipozi, hapo, crisps. If you're a yogurt, like those flavored yogurt lover, you think that is healthy, you love soda, basically all the junk. You're not going to, your child is not going to be any different. These children are going to just look back at the kind of family that you are raised in. If you are raised up in a family that you always had access to junk, it's the same thing that you're going to do when you're an adult. So basically just social engineering, making sure that we teach our children good habits. We ourselves have to adopt the good habits, because you cannot be preaching water and drinking wine when it comes to nutrition. So yeah, those are the modifiable factors that I can talk about. So we can talk about adopting the lifestyle that our great grandfathers has, but life has changed. We have become busy. We have outsourced child rearing rather. Child care is being outsourced. So what kind of a person are you going to allow to take care of your child? Is it someone that shares your, the habits that you do? Is it someone that is able to actually stick to a meal plan? If you give them a menu, they are going to stick to that menu. Is it someone that is disciplined enough to know that my child is supposed to eat whole foods instead of baby foods? I'm putting it in quotes because I know that a lot of marketers have, done a lazy job saying that some foods are baby foods. How about you just go to the market and get your own food? How about you go to the farm and buy food that you can cook from scratch? So these are things that are within our control, and we need to adopt healthy habits that are going to make sure that our children are not exposed to UPFs, they're not going to be exposed to junk food, and they're not going to be exposed to things that are going to trigger their metabolic health to cause cancer. Because basically we know that oxidation of the cells is caused by things that we get into our bodies, like the air that we breathe, the water that we drink, and the food that we eat. So all factors considered, if we had safe food, we had safe water, our environment was safe, then those are things that we need to talk about. The control. So
Yeah, I agree. I've actually written down that maybe we need to have a discussion on, or I don't know, on early feeding practices as a prevention strategy for NCDs. Yeah, where now we highlight on the benefits of breastfeeding, the benefits of complementary feeding, social engineering as protective and mass protection and all for the generation, because we need to start where we are at right now. And where we are at right now, we still have people who are giving birth, we still have adolescents, we have under fives. And you highlighted that a baby will be exposed to sedentary lifestyle and too, and then the effects of obesity will have to be corrected later. So you need to stop that before it actually happens, because there's that report that showed that childhood obesity is on the rise. And I have interacted with, I'm sure you have also interacted with mothers who say to each their own. Ukiambia mama wacha kupea mtoto chao hizi vitu, nakwambia to each their own. They tell you, I suffered. You know, people are trying to correct their suffering with their children. And as Grace usually says, people need to heal. People need to heal from trauma. People need to be self-aware and they stop actually ambushing babies with issues, or their babies with issues because they suffered as children. That is the worst excuse that I actually hear with mothers, and it's quite common than we actually think. Mothers think that because niliteseka nikigrow up sikuwa napata access ya kukula chips and chicken, mtoto wangu juu ni mimi nafanya kazi atazikula azishangae. And then your baby starts getting obese, the baby starts getting, yeye ndio anagonjeka tu shule, hakuna mtoto mwenye ataikuwa mgonjwa na kuna tonsillitis because kutoka June lazima umbaie sweetie. We need to have that culture changed. And I think that is very important on their modifiable factors. And maybe we can also talk about, or I can talk about physical movement, because I have introduced the aspect of obesity in children and why it's important in cancer prevention. And even before I go to even the aspect of physical movement, we also need to ensure that we understand that your gut, when you're consuming quality fiber, when you're sleeping well, when you're managing stress through things like physical movement, when you're working to make sure that your gut-brain axis is working well, then you're going to have better gut functionality and get better microbiome activity. And this will actually influence your metabolic outcomes and help you reduce the occurrences of diseases like cancers, diabetes, and other NCDs. So let's talk about physical movement as a strategy for preventing cancer. As we are aware, obesity is currently a disease or a metabolic syndrome, and it has also been linked to occurrences of certain cancers like stomach cancers, colon cancers, and even other types of cancers, metabolic cancers, literally. So they have actually been linked to the occurrences of obesity. If you are obese or if you are overweight, then you are increasing your risk of developing such cancers. And the beauty of physical movement is that it doesn't have to be strenuous. You know, when you think about physical activity, most people think that I need to sit down the whole day, then just do 1 hour of strenuous activity. That is not right. Thank God, I know people are busy and you might not be in a position to move throughout the day, but you can just wake up from your office chair, go and get a water, or even like during your tea break, do a small walk around, say hi to your colleagues, just get out of the phone and just physically move, do some walking here and there. When you're going to work, instead of doing your car every day, every once in a while, leave it if it's not necessary. If it's not like you're not going for a serious meeting, you can leave it and do a matatu. I know matatu culture is hectic and people are scared of it. You can also walk to the stage instead of doing the borders. I was guilty of that sometime back last year, but I am really working on that. And the sun is so hot. That was my excuse, that jua ni kali na ni choma, inanipea sunburns. So I will take a bike and just walk. And I saw a significant change in my weight in less than like 3 months. So we need to do that. So physical movement actually improves insulin sensitivity. How does it do that? Of course, in an increased utilization of the circulating blood glucose that you have taken either from food. And of course, if you have the extra storage, the fats that we don't want in your stomach, in your underarms, in your thighs, in your organs, of course, physical movement helps in reduction of those ones. And of course, it lowers chronic inflammation. You know, when you think about cancer is an inflammatory condition. So inflammatory condition means that it comes due to continuous oxidative stress that causes chronic inflammation. So when you're physically active, you're able to release the dopamine. You've taken care of your gut. You've taken care of your digestion, your movement food is moving well. Now you come into the second aspect now. You release the endorphins and such. It actually helps to reduce inflammation and stress. It also supports the immune functions, and most importantly, it helps with maintaining a healthy body composition. So remember that exercise is a form of medicine. Consistency beats intensity. When I tell that to my client, people will tell me, oh, I want to do this 75 days challenge. But if you do the 75 challenge, you're so intense for 75 days and then you stop. For the next of 325 less 75 days, you stop doing that. Inakuwa shida. So you to do that. And of course, all that. So for the children, as Eunice has said, we encourage play, we encourage healthy foods, we encourage intake of quality nutrition and all that. So I think we need to wrap up. I've seen that, Eunice. You can tell us as a parting shot, because we're going to have to continue this conversation because kuna vitu hatujashikia, si ndio mama?
Yes, basically you've done a very good job. I think nutrition is a multifactorial issue. And one thing that I want to insist on is the lifestyle that we introduce our children to. Because remember, intergenerational health is very important in this case. A healthy mother will be, will make a healthy baby, and a healthy baby is going to make a healthy adult. So let's not introduce our children to screens very early. Let's get them going. Let's get them moving. Let's give them the good food, something that is going to be healthy for them. I think maybe I did not mention what a UPF is. It's basically a food that comes from the factory that has more than 4 ingredients. Kama unasoma lebo alafu unapata ingredients zingine hawezi mention, just know that examples of some sweetened fruit juices, in quotes, because they're not actually fruit juices, they're just chemicals. Some yogurts, some crisps, chips, those frozen foods that we do not even know where they come from. If it's whole food, that is okay. But if it's something that you do not, like it has more than 5 ingredients that you do not even recognize, then definitely it's something that you shouldn't be introducing to your body. These things, remember, our body is living. If it's introduced to things that have been manufactured in the lab, remember they're going to engineer our system. Remember that is where the cancer develops, because our cells are being regenerated by something that is not natural. So I know that it's a very wide discussion, especially cancer, because it has a lot of factors, obesity, other diseases. We know that we have vaccinations that are going on that can actually prevent. So we've not even touched the surface on when it comes to prevention. So I think we're going to, get another chance to talk about those things, because we've not even talked about screening, awareness, and all that. So I think I'm going to stop in there, and then we're going to continue from another day. Thank you so much for the opportunity, Lilian.
Thank you, Eunice. You're definitely going to have to continue this conversation because there's a lot that we have not talked about. But as we wrap up, remember that prevention does not happen overnight. Of course, you have to be intentional before it becomes a habit. I know some changes, the body change is not easy, and people actually resist a lot of changes, but let's be intentional about changing. Let's be intentional about nutrition. Remember that we have different exposures. I hope I have explained where the exposures come from and how your body reacts to different interventions. So if you have a parent, if you have a patient, or if you yourself actually struggle with cancer management and nutrition, please seek out for nutrition services. Make sure that you get a professional to actually walk you through how you're going to actually manage your condition. If you have any issues, let's try as much as we can to work with professionals, because of the ethics and the regulations that are there for our practice, we have to do what is best for you. So I thank you so much. Thank you so much. Thank you so much. If you have listened through, or if you listen to this after this, and if you have any question for us, leave it in the comment section. I'll definitely be looking for it, and I'll answer it. And even my guest will be answering it as well. Remember that Eunice is a pediatric nutritionist, so if you have issues with breastfeeding, feeding yourself, complementary feeding, if you have issues with taking care of the baby, you have a baby who's suffering from any forms of pediatric cancers, you can definitely reach out to her. I will text her number in the comment section that I will be sharing some resources so that you can have a look. I also do consultation on the same, so make sure that you reach out. We talk about hormonal health, we talk about gut health, we talk about metabolic health, blood sugar control, and any other condition that you might require assistance with. Thank you so much for joining us. Allow us to log out to tukakule lunch. It's 2:10 and we started a bit late, but next week tutaanza mapema. So asanteni sana. If you have questions, leave them in the comments. We'll definitely be chatting there. And let's remember, prevention starts today, not tomorrow. So today is the best time for you to start drinking enough water, to start taking your walk seriously, to start prioritizing quality nutrition, and to start prioritizing sleep and self-care. So let's not work with tomorrow, because tomorrow never really comes. So thank you so much, and I will be seeing you next week on Wednesday. Bye.